Game logic is essentially the set of laws of physics and the medical rules. It creates a space where multiple outcomes can happen based on how the player interacts with those rules rather than just playing a fixed animation. In this way, this tool could guide and assess the trainee knowledge and performance using the institution's own expertise encoded in the game logic. But how is that? When I encode the institution's surgical experience into the logic of the simulation, I create a digital tutor that never gets tired, never varies in quality, and is always available. This produces several practical benefits that matter in a real training environment. One, every trainee gets access to expert judgment and guide. This system goes further, evaluating the action using the same reasoning a senior surgeon would use. Example, the trainee makes a skin incision. The logic checks whether it follows Langer's lines, just like an attending would, and then gives immediate expert level feedback. This means trainees don't just do surgical move. They will be guided toward the best practice. And they learn the reason behind the action, and I will specifically show the anatomical reason. Second, the standardized training that reflects the institution's own standards. Different hospitals and departments have different preferences, techniques, and safety thresholds. By encoding the institution's experience into the logic, that is, into the rules of the game, the simulation teaches the department's way of doing things. And every trainee receives the same standard of guidance. And the assessment becomes consistent, objective, and aligned with the curriculum. It would be an opportunity in showing variability between tutors by creating multiple versions of the same surgical scene. Third, the expert guidance becomes available 24/7. Human tutors are limited by time, fatigue, and availability and number of trainees they can supervise. The simulation removes these limits. Trainees can practice anytime, as many times as they want, and with the same high-quality feedback every session. This dramatically increases training volume without increasing faculty workload. 4. The automatic assessment that mirrors real surgical judgment. Because the logic encodes expert reasoning, the system can detect errors, reward correct technique, and track improvement, identify weak areas, and provide personalized feedback. This turns the simulation into a true learning and assessment tool, as the trainees can toggle easily between the two interfaces, one for learning and the other for testing their knowledge and decision making. 5. Institutional knowledge becomes scalable and permanent. When a senior surgeon retires or moves, their expertise often disappears with them. By encoding their judgment into the simulation, the institution preserves its surgical culture. The way we do things here becomes a permanent asset. The new trainees inherit decades of experience instantly. So we capture the institution's surgical expertise and encode it into the game's logic, creating a simulation that guides and assesses trainees with the same judgment a senior tutor would provide consistently, objectively, and at unlimited scale. The code of the game is a text that opens a great opportunity for living the experience and interacting with it.